It's open enrollment season again, and it's especially important to check your coverages and make any necessary changes. Medicare open enrollment just kicked off yesterday, and with many coverages available to fit most anyone's health needs, we've got the information for you right now. Chris Abbott, he's a health plan chief executive officer at United Healthcare, Medicare and Retirement. Great having you, my friend.
Oh, it's good to be here. Thanks for having me.
All right, so Medicare open enrollment, I know for some people they hear those three words and their eyes roll and they're like, oh, not again. It can be confusing, but there's some options here. Let's talk about Medicare open enrollment and why it's so important.
Well, you're right, Sean. It does feel confusing, and I know lots of times people go, why do I want to do this again? But it's really important. This is why we actually have an annual open enrollment period. Runs October 15th through December 15th for 58 million Americans who are on Medicare. The reason why it's important is those plans can change from year to year, but again, more importantly, things might change in your life. Yeah. This is the one time of the year you can make a change. We're looking at 2018 already. We want to make sure you have the plan that's going to work the best for you.
Exactly. You don't want to be paying for something perhaps that's too rich for what you need, or vice versa. You don't want to be underpaying for something that perhaps might not be able to cover everything. You could save a lot of money in the long run with the right plan. Reviewing those plans, though, what are the most important things to consider when you're sitting down and taking a gander at what we have to offer?
So what I typically recommend, Sean, is first people take a look at the plan that they have right now. They got that information over the last couple of weeks. If that plan is going to continue to meet your needs, you're probably all set for 2018. But if the plan has changed or your life circumstances has changed, that's kind of a flag. You need to shop a little more. Take a look at the budget aspects of that plan, not just the premium, but as you access care, is there a deductible? How much is it? Are there co-payments? How much those are? So look and make sure that plan overall continues to fit your budget. Make sure that the medication that you take are part of that plan. Hopefully they'll also be at the most affordable tier or level within that plan. Validate that the doctors and hospitals you prefer to access are available to you. Mm-hmm. So again, whether you're on a Medicare Advantage plan or some other plan, is that you're going to be able to continue to do that. And last but not least, take a look at some of those extra services. This is one of the advantage in Medicare Advantage plans, whether that's dental coverage, vision coverage, hearing aids, a fitness club membership. Make sure, again, that you've got access to the services you really want and need.
Absolutely. And for those people who are just aging into the whole Medicare system, the difference between Medicare and Medicare Advantage, what is that?
Well, the two ways to get your Medicare. The traditional method, A and B, you've got cost sharing, you've got unlimited exposure. Medicare Advantage, on the other hand, offered by private companies like United Healthcare that have a contract with the federal government. We take A and B, put it into a single package. We build in, first and foremost, that financial protection piece. Gotcha. And then second, we build in prescription drugs in most cases. And then, as I was saying, we provide coverage for some of those things traditional Medicare doesn't, like dental and hearing aids. You know, again, your teeth and your ears may be important.
Why is that not part of everything else? I'll never understand. It's connected to the body, but so I guess it's not health. It's very strange. Really quickly.
Something for us to put on our work list for next year.
Exactly. There we go. But you know what, though? You're filling in the gaps. It's very important with the Medicare Advantage plans. Let's talk really quickly about how long we have to enroll in a Medicare plan. What's the deadline?
The deadline is December 7th. You've got to take action by the end of the day, December 7th, because whatever it is you wake up with on December 8th, that's probably what you're going to live with the rest of 2018.
Absolutely. Now's the time to enroll if you haven't. I know you don't want to do it. You have it on the kitchen table. You've been waiting. Now's the time to take action. If you do have a Medicare plan, make sure you review your coverages, make any changes needed. The website you need to visit right there on your screen. United Healthcare, proud sponsor of the Morning Call.